Good afternoon, good evening, everyone. My name is Keisha Millett. I'm a staff attorney with the Fair Chance Criminal Justice Project at the North Carolina Justice Center, and wanted to welcome you to our community conversation on prison conditions, COVID-19, and access to healthcare. This community conversation is part of a series of events for the second annual Vigil for Freedom and Racial Justice. The purpose of the vigil is to highlight and address mass incarceration and state prison safety during COVID-19 and provide a public, high-profile platform to uplift the needs, voices, and calls for help of mostly Black North Carolinians in prison. Our coalition intends to remain standing in collective vigil each day from December 1st from sunrise to sunset until January 1st, 2022. To learn more about the vigil and sign on to our letter, visit the website www.decarceratenownc.com. A series of discussions on the impacts. We will continue our community conversation as a part of a series of discussions on the impacts of the carceral system on the lives of North Carolinians. And now I will hand it over to my colleague, Rebecca Cerise, with our Health Advocacy Project, and she'll provide a run of show and facilitate this conversation.
Thank you, Keisha. Welcome, everybody. I am Rebecca Cerise. I'm the policy advocate at our Health Advocacy Project at the Justice Center, like Keisha said. I'm just going to give a quick run of show and talk about some logistics. Obviously, we've all been on Zoom for 2 years now. Just stay on mute while other folks are talking, but please feel free to chat, put questions in the chat for any folks that are talking that you might have questions. So we're gonna first talk about Sierra Cobb, who is a paralegal, a community activist and advocate living in Greensboro, North Carolina. We'll first be discussing why it is an important issue to be addressed and reflections on what is happening inside our carceral system. After that, we will hear from Dr. Felicia Arriaga, who is a visiting research scholar at the Princeton School of Public and International Affairs, teaching race, power, and inequality and race and public policy for the 2021-2022 academic year. She's an assistant professor of sociology at Appalachian State and the NC statewide Police Accountability Network coordinator. And that will be rounded out by me talking a little bit about some of the health related issues, how the decision to not expand Medicaid has complicated these matters even further. And then we're going to have some space for other folks to talk or chat and ask questions after that. So with that, I will turn it over to Sierra.
Hey, everyone. Thank you for joining us. So I will be talking about the conditions of the prison, especially during COVID. We're getting reports that, especially when COVID first started, they wasn't giving them any type of, they didn't have any soap. They were giving them watered down Clorox, so it wasn't really cleaning the surfaces. They had people crammed on top of each other. So it was just really unsanitary. It's already unsanitary in our prisons as it is. But COVID made it worse. On top of now, we have short staff. So that makes it 10 times worse to be incarcerated. Conditions are horrible, deplorable. I just got a call from a guy that was in Central Prison, and he was telling me how segregation was absolutely disgusting. They have rodents, and he said it was feces, and when they pepper spray them, they are basically keeping them in the cells, pepper spray, not even taking them to have them washed off or clean. So it's really important that we are bringing this to attention. The fact that our prisons are so close quarters, it's hard to, you can't do 6 feet distance inside a prison at all. The staff doesn't want to be vaccinated. So therefore, they're the ones bringing it in our prisons because we know the ones incarcerated can't come out. So, they don't want to be vaccinated, and it's causing them to be short-staffed. You have a lot of people that are incarcerated that don't want to get the shot because of experiences before of them being experimental. They like to experiment on them. They're one of the first ones to experiment on. So a lot of them have fear of getting vaccinated because of things like that and not trusting the system. Health care is not even existent really in North Carolina prisons at all. Mental health is definitely not there. I'm getting calls about people needing certain surgeries done that DPS is denying when it's medical necessity, and they have backup as to why they need certain things done. And they're saying, oh, well, we can't pay for this, or just give excuses and reasons. The staff is very hateful. I understand that they're under stress. We all are. And you know that when you take a job inside of a prison, you already know what you're going to get. So I just think that we need to do better about training the officers, because the things that I'm hearing that they're doing to these people are egregious. I mean, the things that they say to them, how they treat them, is just horrible. And I think that we really need to uplift that. Even though North Carolina was able to let go almost 3,500 people, it still didn't decarcerate or depopulate as much as we needed. So we really need to do better about bringing this to the light, and people understanding that our loved ones, even though they have committed crimes, some haven't, are suffering behind these prison walls. And I will turn it back over to Rebecca.
Thanks. Thanks for sharing those horrible, talk about those horrible conditions. Just unbelievable what we allow to occur to our fellow human beings on this earth. Very upsetting. So don't think there are any questions as of right now, but again, if there are, just please put them in the chat. And I will turn it now over to Dr. Felicia Arriaga.
Thanks, y'all. And I'm going to share a PowerPoint that I'll also give folks the link to, just because there's a lot of information in it, and I know folks would like it additionally, but it's on my website, on my academic website as well. So I'm just going to present a few of the slides and just go over some of the data that we have. So one of the things that I think at the beginning of the pandemic, I'd already been doing some research on just some jail policies, and was interested in looking at sort of how sort of jails were responding to the crisis. I mean, obviously, like, as most of us know, right, there's issues of accountability and transparency on a regular basis within jails and the prison system. And so I assume that we would also have some issues with just figuring out how many people are experiencing COVID-19 symptoms, getting vaccinated, all of those things. So currently, and this is the one thing that I think as we started to go through the pandemic, the Department of Health and Human Services did start to put up some information about how many jails and how many individuals who are incarcerated within the jails we're experiencing COVID-19, as well as the staff, which Sierra just mentioned, right? So we know that sort of if there's a high number of staff that have COVID-19, then it's going to be likely that they're actually going to give that to folks who are incarcerated. So as of yesterday, I think they update this every Tuesday and Friday, 25 jails. So we have 98 jails, I believe. Someone can correct me if I'm wrong about that. We have 100 sheriffs, but about 98 jails, because some of them share. And 25 of those have some COVID-19 cases of those who are incarcerated. So that's about a quarter, right, of folks who are doing that. During the middle of the pandemic, this was higher at times. So I think maybe at the height, there was probably like 40 or 50 of the jails. So about half of our jails in the state had some individual who's incarcerated with COVID-19. Right now, the highest number of folks, or the jail with the highest number of people who have COVID-19 cases is the Mecklenburg County Jail. And so I do think that this is something that is important for us to know, sort of the extent and also what the response is, right? So we also know that folks have died in the North Carolina prison system with COVID-related causes. And so that's important for us, I think, to just make sure we focus on too. The other thing I'm just going to share quickly is, well, this is a good graphic just to think about sort of the role of the sheriff. So most of my research focuses on looking at jails and sort of how sheriffs sort of play into the bigger sort of carceral state. And so we sort of like really think about the jailing piece as really central to understanding COVID-19 because people, right, don't have the ability to actually socially distance, right? They don't have sort of access to certain things that we would, that we've been constantly told is sort of one of the ways to stop some of that. So just want to sort of do that. There's a bunch more information in here, but I'm just going to get to some of the data that we were sort of collecting, which was looking at the number of individuals who whether or not sort of the jails were actually decreasing the number of people who were incarcerated. And so we did about, we just finished up our third round of data collection to look at this. And so I think as maybe Sierra mentioned this, but we saw that at least like initially back in sort of March, April of last year, we did see like some jails the sheriffs were working with district attorneys to release people, right? So to try to at least like decrease some of the population. But then we saw that sort of go right back up as we sort of went later into the pandemic. And so we have this information for most of the counties. I think the other thing too that often I was researching was looking, I mentioned before the number of cases. So this is from March, where we saw this year that there wasn't that, or at least there was like, seemed to be that they were getting maybe control of COVID-19 in some of the jails across the state. So only sort of a handful of jails where we saw individuals who were incarcerated who had COVID-19. But this is yesterday, this report. So this is, I think, 25 or so of the jails, right? And so we're seeing sort of that increase go back up as we see sort of the, I can never pronounce this word, Omicron sort of variant go up too, right? So it's just important for us to look at, I think, both the sort of staffing pieces, which we see here, right? Like Mecklenburg County Jail, there's a lot of folks who have COVID-19 in the jail, but we also see that a lot of sort of staff, right, have it too. And so that, as Sierra mentioned, is a huge problem as we think about this too. And then the only thing I also wanted to lift up too in sort of a different way, because we're going to be talking about this tomorrow on a different conversation, is at the same time that some of these things are happening in the sort of county jails, we also see that some of these sheriffs who are in charge of the jails are also engaging in immigration and custom enforcement. So at the same time that sort of we see these things happening, because we don't necessarily have sort of transparency and accountability around a lot of different policies, we're seeing that sheriffs are actually continuing to do sort of bad things and continuing to actually, I think, take advantage of what's going on in this moment. And this is also really important too, because in ICE detention centers where individuals who might be arrested locally are being sent to, there's also these huge cases of COVID-19, right? And so some of the questions that we've been asking have been about sort of transfers and sort of when people have been transferred out of sort of our local jails, what does that mean for sort of their, the probability of them getting COVID-19 as they might get transferred to an ICE detention center somewhere else. So I'm just going to stop there and I'll drop the sort of the PowerPoint into the chat if folks want to look at that, and you're welcome to sort of look at any of our other data we have up on our website too.
Thank you so much, Felicia, for sharing that data that you've been collecting. It says a lot about where we are right now. I'm just going to say a few words myself about our state's decision not to expand Medicaid. So Medicaid expansion was a part of the Affordable Care Act. When the red states took the Bowman administration to court to try and fight the individual mandate, the Supreme Court decided that the Medicaid expansion piece of this, so expanding Medicaid to include a lot more people than it covers now, including adults without dependent children, which is me. When I was unemployed and I don't have kids, I was never going to be eligible for Medicaid, no matter what. The Supreme Court found that it was optional for states, that they made it optional for states to expand Medicaid. So healthcare advocates have been working for almost 10 years to try and reverse that. We are now, North Carolina sadly is now one of only 12 states that has not expanded Medicaid, despite a lot of financial incentives to do it. But of course, the biggest part is the human incentive to make sure that people are covered, in particular during a pandemic. It seems particularly cruel to, not expand healthcare during that time. And in terms of what we're talking about tonight with the carceral system and people who are in there during this pandemic, it makes it even worse because Sierra was saying before how there's no healthcare within the carceral system. Well, too many North Carolinians can't get the healthcare they need before they enter into the carceral system. So a lot of folks are left without being able to treat mental health issues, substance use disorder issues, and instead we're criminalizing that. And people are ending up incarcerated for those health issues. Which is just wrong, flat out wrong. But in particular, during a pandemic, it is actually even worse because you know, people are their lives are put at risk when this occurs. And sadly, same thing upon re-entry, not really, there's no real health safety net there. Medicaid, you know, is not available to folks once they come out. So the budget that was just passed in North Carolina does have some things in there around medication assisted treatment, in particular for folks who are actually incarcerated. From my just looking at it briefly, it seems to be incredibly bureaucratic, filled with lots of red tape. It seems to be an application process that sheriffs have to go through. It's not something that's just like, yay, we're now going to offer medication assisted treatment for the people that need it, you know, in while they are incarcerated. There's some other provisions in there that seem very vague in terms of before people become incarcerated or after, in terms of making medication assisted treatment or any kind of treatment available for substance use disorder or mental health issues. I'm still trying to figure out what it all means, because like I said, the language is incredibly vague about, you know, sort of what's in there. But I will say this, there is $10 million to a church to open a like clinic to help people with substance use disorder. Meanwhile, there's no evidence that these folks have any idea how to do that. It seems like a big pork project that we're giving money that can be really used is actually necessary in so many other areas, and instead, you know, with evidence-based treatment, and instead we're handing it over to somebody that has no proven track record of addressing this issue in any way. And that's, you know, $10 million, it's a lot of money. So that's the part that I wanted to add into it. In terms of Medicaid expansion, we are continuing to push for it. There is going to be part of the budget was they mandated a commission to study Medicaid expansion, despite the fact that there's literally 10 years of research now that shows that it is positive for all the states that have expanded in so many areas, including cutting down on overdose deaths, you know, and helping people with mental health issues, you know, actually have real access to treatment. So we are going to start like we are going to barrage the people on this commission starting in the new year with the facts, with stories, with phone calls, with emails about, you know, why we have to finally expand Medicaid. And we're going to do like several weeks. We don't know how long the commission's going to be in, but we're looking at like 10 to 15 weeks of like different themes each week. And, you know, we call it healthcare, not jails. So that is definitely going to be one of the issues that we are going to be talking about. So keep a lookout for that, because we need all the help we can get in driving those phone calls and those emails and sharing those stories with the people that need to hear it the most. So with that, I am going to see if there doesn't seem to be any. Are there any questions from the audience that maybe you haven't put in the chat but want to ask now? Okay. Are there any folks that want to share any experiences they have, people who've been impacted, that want to share their experience dealing with COVID and incarceration? Okay. Okay.
If I may.
Yeah. Go ahead. Sure.
So my name's Erica Bowman, and I was actually incarcerated through the bulk of COVID. I was in from 2015 and was just released in April. And I believe it was Sierra who spoke on the conditions inside. And thank you for your facts, because a lot of people don't actually have the comprehension of facts, and it can be far worse than what you're talking about. Like when it's brought in and you're isolated, essentially you're punished, and they don't have the room for social distancing. So you're on bunks, and depending on what prison you're in, Swannanoa has rooms, yes, and there's a bunk bed in there. So you and your roommate are stuck in there, and you're closed off in your dorms. So they lock you essentially in here. You cannot go outside for fresh air. You cannot do anything because you are completely locked down. They bring everything to you. So it's just kind of in there festering, but you have different guards in and out. You're not going anywhere. So you're just locked in here to sit, you know? And in Raleigh, at the women's facility, it's, you know, big dorms that have about 37 bunk beds in there. And there's no way out of that. It's all open. So it is dangerous, and you don't get the care that you need. They'll give you a COVID test, but what else can they do other than that? And then, you know, they put so many restrictions on everything. They're not requiring the officers to get vaccines, but you can't do anything progressive if you're not vaccinated. You can't go to work, you can't do courses, anything like that, and you're segregated because you refuse. But their officers have a choice. But thank you. And I appreciate your facts and the information that y'all are giving correctly, because it is hard for the people who are in there, and there aren't enough people advocating who actually have the experience and the knowledge to know what people are going through and the severity of. So I'm definitely very grateful for everyone's factual information.
Thank you so much for sharing, Erica. Really, really powerful. Your voice is so important in this conversation to really bring your own facts and your own lived experience, because people need to know what's actually happening. Noelle, do you have something to share?
Sure. I just want to echo congratulations, Erica, and I hope your transition and reentry. I know there are a lot of obstacles, but I'm just sending lots of good energy your way as you continue to navigate that. I have two questions. So I monitor pretty closely the DPS website with their COVID information. And for about the last 2 weeks, I've noticed that there is not one number associated with extended limits of confinement. So it appears that they're no longer doing ELC. I just wonder if anybody has information about that. And then I'm also really concerned, and I think that this is probably because of what you mentioned, Felicia, that folks are finally being transported from jail custody, but our numbers are almost as high as they have been in the whole year for 2021. We've got more people in DPS custody now than we have all year. So somebody needs to be shining a light on that. We're dramatically going in the wrong direction.
Yeah, this is Diana Powell. Congratulations, Erica. I am a former employee at the women's prison. I worked there 10 years, left as a lieutenant, and I certainly understand, you know, the conditions and things that you have seen there, and I'm sure that they'll continue to be there. I've gotten calls in the last week from Green Correctional that they're on lockdown now because their COVID positive numbers are going up. I just wanted to share that.
Thank you so much for sharing that, Diana. Does anyone have any responses to the questions Noelle asked about the numbers?
I don't have a question to your first, or sorry, a response to your first question, Noelle. Yeah, but I think Erica maybe put some stuff in the chat, so I'm sure Erica, you can come off mute and let us know too. Yeah, I think that as far as like the numbers going back up, I think I think I'm not sure because I don't think I'm not as involved in the sort of like legal side of things of how sort of like some of that pressure came to make adjustments in not just incarceration, but in jail and policing, right? So that's what we saw, I think, in March of last year, was that not only were sort of sheriffs really thinking more about sort of how do we release folks who might be older or who were sort of could sort of be released early for whatever reasons because they had people who were charged with lower offenses. I haven't heard much conversation about that at this moment, even though we are seeing sort of that spike, right? We also saw, I think, in March, which are things that I sort of this research project itself is called like something, I forget what the full title is, it's in the PowerPoint, but it's like decarcerating jails will solve some COVID-19 issues, but won't solve all of them, right? Because we have so many other issues to tackle, right? And so I think some of the innovative things that people were doing, and innovative to, I think, law enforcement and sort of the powers that be, not innovative to us, is that like some of those sort of folks were saying, right, like let's give tickets instead of actually arresting people, right? And so I don't think we've seen that push. I do think it's an opportunity for communities and particularly like activists to like go back and let's push right on these things, especially as we see sort of the numbers increase. And as we see sort of, as Erica mentioned too, I think that sort of, we weren't able to get as much information about sort of vaccination rates and sort of the incentives to get vaccinated within the jails. So that one I think is one that we're still sort of grappling with on when it comes to sort of the jail arena. I think actually Buncombe, Noel, if I'm not mistaken, is the only place where they were actually offering gift cards to get vaccinated. Of the sort of like 30 places that gave us any information across the state, there's not really sort of incentives or anything happening for folks who are incarcerated. So I think that it is a moment to like sort of encourage folks to think about where were we in March 2020? Like what sort of like things were being put in place temporarily, right? Because we also saw sort of the court system also sort of having a delay in some of their sort of operations too. So I think there is an opportunity to think about those things as we sort of see these increases. And I'm also like, I think also people are tired. So I'm trying to like grapple with like, just like as on a personal level, like will even anybody care? And as we sort of like move into 2022, thinking about if this is going to make any sort of dent in some of the sheriff election conversations, which I hope it does, but I'm also sort of like maybe a little bit too close to like with some organizers to think about what does that look like, right? For us to say these folks didn't do anything, right? And so I'm looking for sort of the framing and the words to think about one, how do we do exactly what you're asking, Noel, and really like remembering that in March 2020 there were things that we did right as sort of communities to actually try to decrease the reach of COVID-19 and the carceral state at the same time, and how do we actually think about that as like a framing tool for some of the work that I hope people will be doing in 2022 when it comes to accountability as well, and not just I think for the sheriffs but also the DAs, right, and some of those folks too.
I would just like to kind of piggyback off of that. I think as far as the jails goes, if we have more pretrial diversion classes, that would depopulate a lot of our jails. And that's one thing that we have to start working on is getting pretrial diversion classes in the courts, because Fulton County has numerous pretrial services. Like even if you catch a gun charge or even the higher charges where you're supposed to be incarcerated on, they have pretrial services. So you're not just sitting in jail. Because Guilford County has a high amount of people committing suicide. And I'm starting to see that rise in the prisons. Sometimes it's not suicide in the prison. Sometimes it's the COs doing stuff to people and they just want to blame it on suicide. But the incentive to really get them to be vaccinated, like they gave an incentive, but it was only for a short amount of time. They didn't say, well, you know, if you get vaccinated, you have a month to get 10 visits. So it's a lot of people that got vaccinated didn't even get those perks or things or anything that they were supposed to get. So it's about being more accountable with the prison and the jail systems. I'm currently trying to get in touch with our sheriff about our jail because we have a lot of people committing suicide. One guy committed suicide and he was on a $500 bond. Like that just blows my mind. So really just not keeping people incarcerated. Like jail is temporary. It's not supposed to be a long-term stay, and people are staying in there for 2 and 3 years and then get sent to prison. So we just have to do better about what we're doing to people. Like the whole tough on crime thing is just, it's not working. We haven't been safe. It hasn't made us any more safer. So we just have to really collectively start getting some of this stuff done in North Carolina.
Thanks everyone for making those really, really great points. And, you know, I think that's a good bridge to maybe to talk about what are some of the changes that are being pushed and fought for right now at a state and local level around conditions. Love to hear from folks about what's happening on the ground.
I feel like we're trying to mobilize, but when you have such a conservative politicians that are in seats, it makes it hard to do a lot of things. I mean, the task force made a lot of recommendations, and a lot of them recommendations went nowhere because they have to be passed in the legislature, and a lot of it doesn't even pass through the DA association. So if it won't pass there, it's not even going to hit the floor for them to vote. So it's just crazy how DAs have so much power. I don't think people understand that a DA has a lot of power. Like just them two themselves, the DA association, the sheriff association, stops a lot of our criminal justice bills before they even hit the floor. So that's what we have to focus on this year coming up with the DA elections and the sheriff's elections. We have to flip those seats first, and then we go to the state seats. That's just my opinion.
Yeah, I mean, I think the thing I'll add is I guess I learned, when I started organizing in Durham in the Triangle, one of the things that I really appreciated was the local group called the Jail Investigation Team that no longer exists, but that was really sort of like working on trying to figure out what was going on in the jail on a regular basis. And so I think that like when it comes to sort of jail populations and the sort of organizers who are focusing on the carceral state, I feel like there's just so much that we can be doing in this area. And I know that obviously there's folks who work on this on a regular basis. I know like Roberta is on here and sort of does some of this stuff in her work, and we're familiar with each other. I know Noelle pays attention. So I'm sort of excited to sort of see more people sort of pay attention to this. One of the things in sort of like my police accountability role that we're going to be doing in the spring is specifically sort of like a county budget cohort. So really sort of encouraging folks to think about their local budgets and what that means when it comes to the sheriff's office in the jail. So I can send that out to folks who are on this call later as well. But I do think that there's opportunities for us to sort of see a lot of the, I think, pressure that's been put on municipal police. So just like the police chiefs and everything, I think we can sort of see, I'm hoping that we'll see sort of a shift to folks really thinking about some of this stuff at the county level too. But I know that there's like some groups, we work pretty closely with the Police Accountability Network with folks out in Fayetteville and Cumberland County, who I think have both been sort of some of the first ones who even told me that people in the jails were saying that they weren't even getting masks when the pandemic began back in 2020. So I think some of this is just like, right, having obviously that connection to folks who are incarcerated in the first place means that they're gonna feel comfortable letting you know what's going on. Whenever I think we first started doing some of this research too, I'd had friends who called me because they were which I think Erica just mentioned, or I think it was Erica who just mentioned, Diana maybe just mentioned, that whenever the cases start to increase, right, people go, or the sheriff's office and the jails revert back to lockbacks. When in Durham for so long, one of the things that I worked on in Durham was trying with the jail investigation team was trying to get rid of lockbacks on a regular usage in the Durham County Jail, right? And so I think if we don't necessarily have these systems in place and groups who are consistently monitoring, then of course they're going to go back to these things that I think so many folks have worked so hard to try to get out of their normal sort of routine, right? So I'm excited for us to see sort of what that means. I know it's also it's tiring to be in a pandemic. I understand that. I know folks are sort of losing steam, especially at the end of the year. But I do think that this sort of consistent month-long, let's talk about this, let's make this a regular conversation, will hopefully push people to make sure that come January, we're still talking about this, right? So I appreciate folks on this call, folks who have been incarcerated and who are now working as organizers, activists in sort of these spaces, encouraging us to keep it on sort of the forefront of our minds too.
I can give a small report from New Hanover County if you guys are interested. Basically, I'm Roberta Penn. I'm with the Campaign to End Cash Bail, and which is just a whole bunch of different groups that came together to try and end cash bail. And we're still standing 3 years later, but we're having a lot of trouble mobilizing people. We were sitting outside the jail during COVID a lot and making connections through family members who were putting money on. You couldn't visit anybody, but or picking somebody up who'd just been in there overnight or whatever. And we had a letter writing campaign, and we spent a weekend, we mobilized a bunch of people, like 25 people, to sit and write letters to everybody in the jail. And they never gave the letters to the people. They didn't tell us that. But what we found out, finally we just wrote and said, look, we haven't gotten the letters mailed back to us. We haven't heard from anybody. What is going on? And they said, oh, well, we're not delivering them because there's contraband coming in on, we sent them a blank piece of paper and an envelope with a stamp on it. Contraband coming in on stamps. And now they've told us we can write letters again, but we can't put anything in there. And they assured us that if someone was indigent, that they would supply them with blank paper, a stamp, and an envelope to mail out to anybody they wanted to write to. Well, I don't trust that because when I asked what the budget was, they don't have a budget for that. Budget item for anything for indigent people. We are looking into their budget. So that is one thing that we're doing. We're going to try and call them out on what their contracts are with on the medical and also I'm going to try to pin down. I mean, what do you do when you have someone in jail who doesn't have any money at all? What do you do? How do they make a phone call? How do they get a video with somebody? Is there free videoing for certain people? I know I'm beginning to sound kind of angry, and I am angry about it. And I'm also angry about it on the state level too, because I have a friend who's in the News Correctional Institute. I can no longer write to her there because the state has stopped all letters going in. You have to go through a digital thing to send a letter. Well, I finally figured out how to use the app to send something digitally, but I haven't heard anything back from her. So I don't know if it's getting through or not, and that's horrible during the pandemic that they can't even get a real card, a real picture from somebody. They did say we could. I sent some pictures of my dog and some of our, our common friends, sent her pictures of that. So I don't know if she got them or not, because it's been like 3 weeks now and I haven't heard from her. I'm thinking, hey, if she had gotten this thing with pictures and a long letter and all of that, then I would have heard something. So she's not my daughter even, what if she was my daughter or my partner or something like that. So it just seems like they just keep piling on and piling on and piling on. So I think that's, oh, the only other thing is, in case you didn't know, that the sheriff in New Hanover County is the president of the sheriff's North Carolina Sheriff's Association. So we've got the devil up there doing the devil's work big time from here. So that's kind of what I had to say. Thanks for listening.
Thanks for sharing, Roberta. Understandable why you're angry. These are definitely reasons to be angry at the injustices in the system. Wanted to hold up what Erica had put in the chat. And Erica, if you want to talk a little bit about it, you can come off mute, just sort of piggybacking off what Roberta said.
So in the women's prison, it was prior to COVID, they went to Text Now, which is where the family members have to spend at least $1 on the app to be able to send a letter, which is far more expensive than a stamp is. And you can send pictures and stuff like that, but also that mail isn't getting to us as easily, because a lot of times it can get lost in the mailroom, or they're too far behind because they have to read everything and they have to print it. So it adds to their job description, which tends to just aggravate them. As far as what Roberta was saying, as far as people who are indigent, it is hard because they still have to be able to get these stamps and to send this stuff. And, you know, they can't just text to someone. So it's definitely frustrating and extremely hard, and so much goes missing, and you're in there, you can't see your family. The phone lines are terrible because everyone's there and they're aggravated, and then the phones go out half the time. So you have 30 some people who are trying to use one phone to get in touch with their loved ones. And so it's a high stress situation that is extremely hard. And then you can't hear from them. You can't write them. You don't know if you're getting the mail, and everything is just so backed up. And then also someone had said something about the lockbacks. And of course they're way worse in, you know, due to being locked down because of COVID. But then you also have the issue with the fact that they're understaffed. At one point in time, they were on the verge of shutting down Swannanoa Correctional for Women, which is now Western Carolina for Women, because they had taken all of the guards to send them to Craggy because the men's prisons were understaffed. So you completely cripple the one progressive women's prison that we have. So, you know, it's hard all the way around, and there hasn't been one clemency granted in the last several years, even during COVID. Like, I had been incarcerated for 6 years, was completely infraction free. I had applied for clemency, answered everything, and I don't think that it was ever actually read. There was a woman in there who had retired from the Air Force and had been in an accident, and she had already done about 80% of her time, and she had wrote clemency. Phenomenal references. I mean, she retired from the Air Force. You know, she fought for her country for 20 some years and couldn't even get a response on it. And here you are in the middle of this pandemic, and people are dying, and you have people with severe health conditions, and none of those mitigated circumstances are considered at all. So it's hard, but I will get off of my soapbox, guys.
Noelle, do you mind dropping that Google Doc in the chat? We, Emancipate and a couple other people are working on trying to see what we can do about Text Behind. And we're looking for people to tell their story, either incarcerated or their families, because Text Behind is just, it's awful. A lot of people, older people who don't even have or know how to use technology, can't use it. They're talking about being able to send legal mail through Text Behind, which really hits the client, lawyer-client privacy. So we're really trying to get in on this, because they say that when you send stuff I think if you send it through Maryland, they hold it for 7 years. And then I think the legal documents are held for supposedly 30 days, but we don't know how true that is. So we are really working to see if we can dismantle this contract. It's a contract for 3 years. So we're trying to dismantle that and see if there's any legal legalities we can go as far as that goes. And I think Noelle just dropped that Google Doc in the chat if y'all want to share it. And if you know somebody that wants to tell their story about how text behind is hindering their communication with their loved one. And to me, it was just another money grabber. I mean, you have, my husband's incarcerated. So I have a text behind account. I have a GTL getting out for the tablet. And then I have a GTL account for the phone. So you have 3 or 4 accounts and state has all your information, your credit card information, all of that just to stay in communication with your loved one. That is awful. And I think you also have to pay for video visits. So it's definitely a money-making thing. And they just keep trying to find ways and excuses to implement things to make the family suffer even more than what they're suffering.
Wow, cutting people off from the outside world, their loved ones, and making everything cost money seems particularly cruel, in particular at this time, but at all times. Oy, a lot of work has to be done, that is for sure. Does anyone else have anything else that they want to share? We're coming to the end of our hour. Any of my colleagues, Keisha, Tim, or Laura, have anything they wanted to add to the conversation? Okay. Going once, going twice?
Yes. I'll just make sure I put in the chat information about the vigil. If anyone is interested in getting more involved and thinking of ways that even beyond the vigil, we can work to address these issues, kind of like what Sierra raised. And thank you all so much for being willing to be in this space and have this conversation. It's really important to discuss, and I hope it's just kind of early in a set of actions that we'll take to address these issues.
Yeah, thanks, Keisha. So yeah, so you'll drop some information in. So also please follow on social media, on Facebook at the Vigil for Freedom and Racial Justice. And on Twitter, it is Decarcerate Now 1, the number 1. I'll actually put that in the chat as well. Okay. So that's yeah, so follow what they're doing, what's going on at these vigils every day, and keep fighting. Like Keisha said, thank you all so much for joining the conversation. There are going to be more conversations like this as we push for systemic revolution in the way we treat our incarcerated folks here in North Carolina. It seems like it's absolutely going in the wrong direction, and more people need to hear about this. I think people don't have a clue that unless they have someone that they know or care about that is involved in the carceral system, I don't think most people have any idea what's going on, and they need to know because it's inhumane what's happening and completely unacceptable. So like I said, to keep up with the vigil, follow on social media, and Noelle just put something. We also have a Facebook group for custody and COVID issues, especially for families with loved ones inside. So check that out as well. And yes, decarcerate now nc.com. So thanks, Keisha. Any last comments or questions before we sign off? All right, well, thanks everyone. Really appreciated this really important conversation, and I wish all of you a safe and healthy holiday season.